For decades, there's been this one type of chronic low back pain that has just stumped everybody, patients and doctors alike. It's this deep, stubborn ache that just hangs on no matter what you throw at it. But what if the whole time we were looking at the wrong problem? What if the real cause was hidden in a muscle the body just forgot how to use? Today, we're going to look at a totally different way of thinking about this kind of pain and how to treat it.
So let me ask you this. Does this sound like your story? You've been through it all with your back pain. You've tried just about everything. And at the end of the day, a doctor tells you, look, surgery is not the answer for you. It really feels like you've hit a wall, right? Like you're out of options. Well, at Vertrae Surgery Center in Dayton, Ohio, a specialist like Dr. Kamal Woods sees this exact story play out all the time. The pain is what we call axial. It's centered right there in your lower back. It's not sciatica. It's not shooting down your legs. You've probably done physical therapy, maybe multiple times, but the relief just never seems to last. And you've been told, pretty accurately, that there's no big structural problem for a surgeon to go in and fix. 11 years. In the big clinical trials for the therapy we're about to discuss, that's how long the average person had been living with this pain. Just think about that for a second. More than a decade of just coping, managing, and looking for an answer that, for the longest time, just wasn't there. Okay, so let's get into the why. To really understand the solution, you have to understand the real problem. And it turns out it's not what most of us have been led to believe. We're about to uncover the hidden mechanical reason behind all this frustration. So let's get this straight right away. This kind of pain isn't coming from a faulty wire, like a pinched or damaged nerve. That's what we call neuropathic pain. No, this is mechanical pain. A better analogy is a machine with a part that's just not working right, causing the whole thing to grind. And that is a huge distinction because it explains why treatments designed to block nerve signals just don't work for this group. You're treating the wrong problem. And here is the key player that's been overlooked for so long, the multifidus muscle. Now, this isn't a big, showy muscle you work out at the gym. It's this incredibly smart network of tiny little muscles that connect each of your vertebrae. Its whole job is to provide fine-tuned stability, automatically. It fires fractions of a second before you even consciously move, just to brace your spine. When it's working right, you don't even know it's there. So what happens? Well, it usually starts with some kind of injury. A strain, a fall, something that jolts the back. Your nervous system, being smart, goes into protective mode and basically switches off the multifidus to guard the area. The problem is, for some people, that switch never gets flipped back on. The muscle just stays dormant. Over time, it gets weak and shrinks. That's called atrophy. Without that deep, stabilizing force, you get that grinding, mechanical pain. And here's the kicker, the vicious cycle. The pain itself sends a signal back to the brain saying, hey, keep that muscle switched off. It's why you can't just will it to work in physical therapy. Your own nervous system is actively holding it back. So if the core problem is a muscle that your brain has basically put to sleep, well, the solution isn't to cover up the pain it's causing. The real solution is to wake that muscle back up. And this is the fundamental change in approach. With a therapy called ReActiv8, the goal isn't to numb you or block pain signals. The goal is to restore function by directly retraining that muscle that's gone offline. You're breaking the cycle. The pain relief, then, becomes the natural result of having a stable spine again. So how does it actually work? It's a small implantable device. Tiny leads are placed right near the specific nerve that tells the multifidus to fire. Then, twice a day for about 30 minutes, you turn the device on yourself. It delivers these gentle pulses that make the multifidus contract, completely bypassing that shutdown signal from your nervous system. Over a period of months, these daily sessions are basically reteaching your brain and your muscle how to talk to each other again. It's rebuilding that automatic connection, restoring stability, and in turn, relieving that mechanical pain. And this chart really spells it out. On one hand, you have traditional spinal cord stimulators. Their job is to basically put noise on the line, to scramble pain signals so your brain doesn't perceive them as sharply. They target pain-sensing nerves, and they're great for nerve pain. ReActiv8, on the other hand, is a restorative therapy. It's not targeting pain at all. It's targeting the motor nerve that controls a muscle. Its goal is to fix the underlying mechanical issue. They're two completely different tools designed for two completely different kinds of problems. All right, so the theory sounds really solid, but the big question is, does it actually work in the real world? Let's take a look at the data, because it shows something pretty unique in the world of chronic pain. Okay, let's just let this number sink in. After 5 years in the main clinical study, nearly 72% of patients had what we'd call a huge success. Their pain was reduced by at least half. Remember, this is in a group of people who, on average, had been suffering for over a decade with no other options. That's a really remarkable result. And here's what's truly fascinating. Most pain treatments have a honeymoon period, right? They work great at first, and then the effect can start to wear off. The clinical data for ReActiv8 shows the complete opposite. Because you are physically rebuilding a muscle and restoring function over time, the results actually get better over the years. The outcomes at year 5 were even better than at year 1. The benefit literally builds on itself. And a more recent study took it even further. It put the therapy head-to-head against the best possible conventional care. We're talking physical therapy, medications, the whole shebang. And the results were just crystal clear. You can see the group that got ReActiv8 had this massive improvement in their disability scores compared to the standard care group. It really proves that for this specific problem, just trying harder with voluntary exercises often isn't enough to break that neurological cycle. So all of this naturally leads to the biggest question of all. Could this be an option for you? And it's so important that we talk honestly about who this is for and, just as importantly, who it is not for. So let's be really clear here. This is not a solution for people whose main problem is sciatica or that sharp nerve pain running down the leg. It's not for someone who has a clear structural issue like severe stenosis that a surgeon needs to fix. The major studies also looked at people who had not had a previous surgery on their lower back. And finally, you have to be committed. The therapy relies on you doing those 2 sessions every single day. Getting the right patient for the right therapy is everything. And that is precisely why the evaluation is so critical. When you see an expert in this, someone like Dr. Kamal at Vertrae Surgery Center in Dayton, Ohio, the whole point of that meeting is a clinical conversation, not a sales pitch. It's about getting to the right diagnosis and finding the right path for you. Honestly, for them, figuring out that someone is not a candidate is just as much of a success as finding someone who is. The only thing that matters is getting clarity.
So, we'll end on this thought. For years, so many people have been told to just live with their back pain. But now we understand that for a very specific group, the root cause is a fixable mechanical issue. It's a crucial muscle that the body has simply forgotten how to use. If the story we've told today sounds a lot like your own, maybe it's time to ask a different question. Could the answer to your back pain not be in masking a symptom, but in waking that muscle back up? That's a question worth asking an expert.